Hello everyone, welcome to our February workshop. Tonight we're going to be talking about bronchitis and pneumonia here at the BioTouch Center. We have a speaker tonight. Her name is Dr. Sandra Willingmyre. She's been in practice for over 30 years and has dealt a lot with her patients with bronchitis pneumonia. So we are going to give the show over to Sandy now, and she's going to share with us her experience and hopefully educate us a little bit on these conditions.
So, about over 100 years ago, Sir William Osler, he was the director of Johns Hopkins School of Medicine way back in the 1890s. He said, pneumonia is the captain of the king of death. He's the captain of the men of death. He's the king of death as far as that. I mean, infectious disease has come a long way since then, but still, pneumonia on the 10 top leading causes of death in the United States, it is number 8 still. Now, it has actually improved a little because a couple years before it was number 7, but it is still the leading infectious cause of death in the United States. And like over 1 million people go in the hospital every year from pneumonia. So what is pneumonia? It is the classic picture of pneumonia is the patient starts, they get a bone-shaking chill. Not just, oh, I felt cold and I put a sweater on. No, it can last from 10 to 30 minutes, this chill, you are shaking. And then that's rapidly followed by fever. And then you start coughing, and it starts out dry, and then it becomes productive cough with like mucousy stuff, and then it becomes the classic rusty sputum, which is bloody. It becomes bloody. They used to call it lung fever, if you've ever read those old novels, you know, romantic novels from Charlotte Bronte and all. So the thing is, in pneumonia, you have an actual physical finding. So if you listen to the lungs in pneumonia, they are not clear. Listen with a stethoscope, and you're hearing rattling or hearing rails, crackle, 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 or something. You're hearing something going on in there. Or you may be hearing nothing. You go down this side, and you hear lung sounds, and you go here, and you don't hear anything. Something's going on. So then you get a chest x-ray, and then you find these different patterns of, you can have a pneumonia in one lobe. I know how they used to say double pneumonia. I never knew what they meant. I think they meant in both sides of your lungs. Maybe that's what they mean by double pneumonia. As a doctor, I don't really know what that is. Now, unfortunately, some people don't read the book, and they don't realize that they need to read the book and have all these classic signs for us to diagnose that they have pneumonia. And unfortunately, one of the groups that, and still the people who most often get pneumonia are the elderly people and young, very young children. And in the elderly, you might have no fever, no cough, but they might just be confused, or they might not be themselves, or have malaise, don't want to do anything. What's the matter with you? I don't feel myself. So that's one of the problems that doctors in the emergency room have to look for when they see these things. And Sir William Osler said that pneumonia is a disease that runs its course with no influence. It cannot be influenced by any medicine. So they had nothing back then. There was nothing you could treat it. They just treated it with supportive care. You got, good nursing care. You got broth or gruel. If you could take fluids. Now we have IV fluids. We have, ICU, ventilators, mechanical ventilation, antibiotics, all these things. But yet still, it's a serious condition. People just say, oh, well, there's antibiotics, so I could be treated. Still, people die from pneumonia. Like I said, it's the 8th leading cause of death in the United States. So the other thing that people have is, with a classic presentation, is they can get pain in the chest. And it's so interesting to read this. I have a copy of his original textbook from 1892, and he describes it. The patient lies on the affected side, and the eye is bright, and the expression is anxious, and the cheeks are flushed, and he's holding his side because it hurts to breathe where the pneumonia is rubbing against that pleural cavity, your lung cavity inside. So what are the causes of pneumonia? So the top cause still in all hospitalized people is Streptococcus pneumoniae. And what is Streptococcus? It's a bacteria that when you look under the microscope, it's purple. Looks like a purple necklace. It's called gram-positive anyway. It looks like a purple necklace, and it loves to form little like doublets. It likes to form these little pairs. And so they call it it used to be called the Diplococcus or Diplococcus pneumonia. And it's so interesting because Osler says the Diplococcus, in his description of it, I mean, this is in the 1890s, he says, the Diplococcus is invariably found in the diseased lung because they did a lot more, post-mortems back then, and they looked at all these things that happened to you as you got ill. And anyway, now we get antibiotics. So if you go to the hospital and you get you get diagnosed with pneumonia, they will give you a drug which is not really super specific. I mean, it'll cover a lot of things. They'll usually give you a Z-Pak, Zithromax, or they will give you doxycycline, which is something like tetracycline. If you're in the hospital and they know exactly, they narrow the antibiotic to something that's much more specific just for pneumonia, that germ, the pneumonia germ. Now, in the past, when I grew up, 100% of the pneumococcal bacteria was susceptible to penicillin, and now it is not because it's been overused so much. So some people have drug-resistant pneumonia, drug-resistant pneumococcal pneumonia. If you're a healthy person, they'll just give you this one drug only. If you're not so healthy, if you're immunocompromised, if you're on steroids, if you have heart disease, lung disease, all these other kinds of things, dialysis, they'll give you 2 drugs. They'll give you 2 different drugs, one to cover what they think is pneumonia, and then something else that's stronger. They'll give you Levaquin, which cost $1 million. It's very, very expensive. Levaquin, or they'll one of the fluoroquinolones, or they'll and plus they give you the regular old Z-Pak or the doxycycline. They give you the first treatment that you get if you're healthy. Plus they have to add something on. So you want to stay healthy, right? Another risk that I thought was interesting is that if you, not live or work in a nursing home, but if you work in daycare, you are at an increased risk of having, drug-resistant pneumonia, pneumococcal pneumonia. So them along with alcoholics, good old Osler, they didn't pull any punches. It was interesting. He says, as far as, the presentation of pneumonia, like I was saying, that the elderly, sometimes they don't have a fever, they don't have a cough. It says, in old persons and drunkards, there may be no cough. So, he didn't pull the punches, did he? So the other thing is when you go into the emergency room, usually they don't test for pneumonia with these specific tests unless you're going to get admitted. If you get admitted to the hospital, they try to get a sputum culture, which a lot of times, the person, they try to cough up stuff and they don't have a good cough reflex. They can't really get sputum. So you have to make sure that you really have sputum, which is deep lung, not just spit. A lot of times we'd order sputum cultures, then call the lab. Oh, no, wasn't a good culture. It was just spit. But now they have this molecular test that they can test for all these weird things. Because like I said, the top cause, maybe 40% of pneumonia is Streptococcus still. But what's the other stuff? Well, viruses, and then there's this thing called chlamydia, which I guess if people have heard of chlamydia, the STD, and the sexually transmitted disease. And that can also cause pneumonia. It's a different strain, it's like a cousin of this chlamydia. Then you can get it from Legionnaires, Legionella, I was actually in Philadelphia when they first discovered it. came into note, it's a very fastidious organism. It won't grow on a normal culture, so they had to really look for it when this Legionnaire's disease came out in Philadelphia in the 70s. And then they have mycoplasma with the so-called walking pneumonia, where you listen to the person and they're sick, but the lungs don't sound bad, and then you get a chest x-ray because they're like, I felt terrible, you know. And the chest x-ray looks a lot worse than the patient does. So that's that thing called mycoplasma. And then there's another thing called hemophilus, people with alcoholism and COPDers, a lot of them get that. The thing is that a lot of these bacteria live in your mouth. I mean, 40% of people have pneumococcus in their mouth. People have hemophilus. Kids get hemophilus. So why don't we get pneumonia? Well, because you have a cough reflex. Because if you don't smoke, you have all these little cilia, these little frondy, little weighty things that in your trachea and your bronchial tubes, if you haven't burned them off with smoking or whatever, they sweep the mucus out. And then if your immune system, if it gets in there, a lot of times your white blood cells can take care of it, if you're like a basically healthy person. But anyway, other things that can cause pneumonia are like fungus, bat droppings from birds. People can get psittacosis, psittaci from people who take care of birds. You can get it from rabbits. Tularemia, there's this disease in rabbits that you can get. And then, of course, there's the viruses, all these viruses that you can get. So bronchitis, what's the difference between bronchitis and pneumonia? Is that bronchitis, you might have wheezing, you might have, a little wheezing or rattling, but when you get the patient to cough, it clears up. With pneumonia, it won't clear. The chest will not clear with coughing, and the x-ray will be clear. So that's the difference between pneumonia and bronchitis. But the other thing I wanted to say about, I don't know how many anti-vaxxers we have, anti-vaccine people. I used to get every vaccine that came up the pipe. When I was a resident, I had a patient she was in her 70s. This is in the 80s now. She was in her 70s, and she was admitted with pneumococcal pneumonia. And then, sometimes it's not just pneumonia. 25% of the time when you get pneumococcal pneumonia, it can get into your bloodstream. So then you have what we call bacteremia, which the germ is in your bloodstream. Blood is supposed to be sterile. Nothing is supposed to grow out of blood, or urine for that matter, but especially blood. And she had bacteremia, and then she got meningitis. And that's bad. I remember telling my another resident, well, she's got pneumonia and she's 70. And she's got this, and then she's got meningitis, and she was like, no. No. So anyway, she did die from that because it was just, so when that happened, I remember they had just come out with the pneumonia vaccine, and I went to the office and I got that vaccine, and I went home and I vaccinated my mother because, it can be a bad thing. So back to bronchitis. Now, bronchitis, unlike pneumonia, is 90% of it is viral. And a lot of people don't know. Antibiotics do not work for a virus. You're just spitting in the wind. Plus, you might get thrush, you might get a yeast infection, you might get diarrhea, and you might get diarrhea, superhuman diarrhea, the C. diff. There's a bad diarrhea. You get this bacterial overgrowth it's called C. diff, and it's a mess. So that's why I really don't like antibiotics in bronchitis. But, for years, people would go to the doctor and like, oh, I'm sick, I'm coughing, do something. And the patient wants something done, and the doctor also wants something done. And before I knew that 90% of all bronchitis was viral, I remember I had bronchitis 3 years in a row. I took antibiotics. I didn't take antibiotics. I still cough for 2 weeks. You're just going to cough for 2 weeks. That's just the way it is. But a cough that lasts more than 2 weeks. So unfortunately, we're going to cough for 2 weeks. But if it lasts more than that, What could it be? Well, you have to think about whooping cough. I don't know if you remember, like a couple years ago, there was this outbreak of pertussis, which is whooping cough, in Vail. They had this big outbreak of it. And then the other thing it could be is that mycoplasma pneumonia, especially now. So that if it's one of those things, you would give that to you would probably give somebody antibiotics. If a person with COPD, I guess everybody has this chronic obstructive lung pulmonary disease or lung disease, chronic obstructive lung disease, emphysema, chronic bronchitis, the people that smoked 100 years and they got chronic cough every morning. If they get sick, you usually give them antibiotics. Because if they do get an infection on top of that, a lot of times the bronchitis can weaken their whole system, and then they'll get what we call super infection on top of that. If they do get a pneumonia on top of that, it's much worse. So if you get admitted to the hospital with pneumonia, the mortality rate is anywhere from 2 to 30%. Unless you're in the ICU, then it's up to 40%. And it's very interesting. Why does it range so much? Well, probably because, like I said, it depends how sick you are before you get into the hospital. So, and it depends, if you have good protoplasm. If you've got a person who's 32 years old who's got nothing wrong with them, that's a lot different than if you have somebody, 68 with diabetes and high blood pressure and heart disease and all these other things that could happen that affect your immune system. And with pneumonia, it's funny. The mortality rate back in the very early first part of the 1900s was about 30%. It was about 28 to 30%. So it still can be that high today, despite, like I said, despite all those things that we have in medicine available now, IV fluid support and antibiotics and ventilation. We can breathe for you if you're really having a hard time breathing. But anyway, back to bronchitis. Bronchitis, the overtreatment of bronchitis with antibiotics costs like $300 million a year. We could buy food with that, really. So that's pretty much what I have to say about pneumonia. And I know everybody probably wanted to know about this coronavirus thing, which is in the news. The coronavirus, like I was telling you, those molecular tests that they have, they have been able to test for the coronavirus for years. Remember the SARS? Remember SARS? SARS was caused by a coronavirus. However, the interesting thing about a coronavirus, it has on its genome, it has a lot of places where it can mutate. There's lots of places, because that's why, like with influenza, why do you have to get a shot every year? Why can't it be like pneumonia, you get a shot and you're good for 10 years, or if you're over 65 the rest of your life? Because influenza as a virus has the capacity to mutate into something just a little different looking, that is not recognized by your body as your antibodies don't recognize it, and it's, you're powerless against it unless you have the correct, it's like you have the correct lock and key, the key is just slightly different. So this coronavirus, unfortunately, came from China, where they have, in rural China, they have a lot of interaction between man and, pigs and other animals. But the coronavirus, the reservoir in nature is thought to be the bat. And, the fact that people will eat a bat or will have contact with a bat. They used to have the SARS started from a civet cat, they thought. So they thought the original reservoir is the bat, which bit the civet cat, and then the civet cat was sold in the marketplace, and that's how SARS started. So this from the bat, and apparently you can eat a bat too, which I don't know why you'd want to, but you can. If you're starving, if I used to tell my kids, if you're starving, you'll eat anything. No, I wouldn't. Yeah, you would. You would eat anything. But that's about the coronavirus. And I said, the cases of SARS, I looked on the CDC website about how many cases of SARS occurred, and they said there were only 14 cases that occurred in the United States. You know, it was a big scare, but people, because SARS is severe adult respiratory syndrome. We used to call it respiratory distress, which is, that syndrome was really bad. You can get respiratory distress syndrome where you have to go on a ventilator. You can't, you're breathing at, 50 a minute, and your normal rate is 18 to 20. The people are breathing, really breathing, working. They're just going to die unless you ventilate them. So, and acute respiratory distress syndrome was very, very bad thing. Yeah. Sorry. Anyway, but so with the coronavirus, there is only supportive care. Okay. And some people need to go in, usually they're admitted to the ICU, but you have to isolate people because coronavirus is spread by, droplet spray. So, alrighty, that's about it.
So is that in the coronavirus, that they don't die from the virus, do they die from when it turns into pneumonia or something?
Yeah. Oh. Because we have coronavirus over here already. We just don't have that strain. And like I said, on those panels that they have, those molecular panels that they have, there actually is coronavirus, adenovirus, rhinovirus, influenza, blah, blah, blah. All the, so you can check for it, but not that strain. This is it. The SARS was the 043, and this one is the coronavirus 19. It's just a different one. And I don't know, there's not a lot of data because, the Chinese are kind of closed-mouthed. So, she's all right back there. About mortality rates and stuff like that, I don't know what information they've given to people, but yeah, there's a lot of worry about it. So we'll see. But if quarantine, you do need to limit the entry of people who've been around there. I mean, that's the only way you can protect people. Is there was a cruise ship that they went to Japan. They went to Japan. Nobody would let them on. They had been in China. They went to Japan. They went to Singapore. Nope. They went to Thailand. They went to, I don't know. I think the final place that allowed them to come in was Cambodia. They went to like 5 different ports.
So when we get things like pneumonia or bronchitis, and so it was interesting hearing it's hundreds of years, 100 years ago they were dealing with the same thing.
Yeah.
What you as a doctor would you advise people in the self-care part of it before they get, or in conjunction with, before it's bad enough to have to go in the hospital?
Yeah. Well, the best cure is prevention. Because a lot of times, once you get it, you kind of, Sir William Osler said the disease is, it runs its course. It's a self-limited illness, meaning it runs its course uninfluenced by any medicine. And so either you got better or you died. So you want to just not get it. How do you not get it? Well, if somebody coughs in your face, no. What can you have a kid coughing in your face, what are you going to do? But, hand washing, a lot of things are caused by fomites. You touch your eye, a lot of the colds. You can cut down 75% of colds if you wash your hands. And I tell people, not just wash your hands, but never touch your face before you wash your hands. Always. And I even do that because sometimes I go, oh no, like if I have do this way, you never touch your face without washing your hands because it's the eye and the nose. Of course, like I said, it tends to be more in the winter time. We tend to get sicker because people are closer together, and people can be incubating these things and they don't feel totally sick yet. So they're out and about and they're make cough and not cover their mouth, something like that kind of thing. So, but the best thing is to wash your hands, try to maintain good nutrition. I swear by that Emergency or Airborne. I love it. It's got super vitamin C and just all these other things in it. And in fact, a girl in the lab where I used to work, still work sometimes, I said, "You're always sick," because she was drawing all these, she saw, I don't know, 100 people a day or something. And I said, "You should take that Emergency." So she started taking it every single day, and she got sick a lot less. She said to me, "You know what? I'm really getting sick a lot less." So super nutrition. I mean, some people laugh at it. When I get a cold, I take a lot of vitamin C. I don't know. The data is mixed, but if it makes you feel better, who cares what the data says? You know what I mean? Right? So, but that, good nutrition, and then exercise too, because exercise is really, I can't say enough about exercise. It helps everything. It helps your stress level. It just helps everything. And then the vaccine, like I said, with the vaccine, I don't know, like the pneumococcal vaccine, I got it myself. I got it. I gave it to my mother. So.
Sounds like, from what you said, flossing might be a good idea too.
Oh yeah,
because
flossing
they
could.
get stuck in there.
Yeah, because you don't. That's why they say with people with alcoholics get a different kind of pneumonia sometimes, this Klebsiella pneumonia, which looks like currant jellies. They get kind of weird pneumonias because you can get a lot of things from teeth. I mean, teeth are really. In fact, our diabetics patients, I used to work at a community health center, Camden, New Jersey, and we were lucky enough to have a dental program. And the dentist we did this Healthy People 2000 project. So we were going to try to improve the health of people with diabetes. And the dentist came and talked to all the internists and the pediatricians. He said, when you have gum disease, bad gums, it's like you have an open sore on your arm this big. And then everybody's cringing like, "Oh, let me go brush my teeth." I mean, really, it's dental care is really important. I used to tell my patients, if you're so scared that you won't go to the dentist, I'll give you Valium to go to the dentist. That's how important I think it. I'll give you a Valium. You got to go to the dentist. But, yeah.
I was going to ask you a question about.
We have to finish up here. So.
Mm-hmm.
Okay. What about using like a neti pot? I know a lot of people use that for allergies and stuff. But would that help sort of irrigating the nose and?
Yeah, and they have something. I could never use the neti pot. I just couldn't be a contortionist. But the NeilMed sinus rinse, it's the same thing. My one doctor told me about this, and you're supposed to use distilled water. Supposed to use that, and that is good because it washes out pollen and all this other kind of stuff. Which yeah, it may help. I don't know if there's any studies, but it's a good idea because you don't want mucus in there that can trap stuff.
You have it.
Yeah. Yeah.
Okay.
All righty then.
Perfect. Thank you. Well, that was a lot of knowledge. So, now that we've learned all about bronchitis and pneumonia, thank you, Sandra. That was perfect. I like these workshops because they help me understand, what I'm working with, And so this workshop here, and we do have a couple new people here, so we'll sort of start from day one about what BioTouch is and how BioTouch can fit into this, especially when Sandra talked about, diet and vitamin C. Well, BioTouch, is something that can be used with this situation. I've worked with a couple of people that had bronchitis, pneumonia. Yeah, understand here, we're not going to teach you something that's going to be like taking an antibiotic, or that it's going to cure pneumonia. But I'll tell you, helping with the symptoms of anything dealing with the lungs, BioTouch is just great to add to your protocol. And it's really simple, and we're just going to give you a few sets of points that you would do in that situation, which can be done just at home, even when you get the first symptoms of coughing or hacking before it even gets diagnosed as bronchitis or pneumonia. Or it can be done in the hospital, right around even with people intubated, I worked on my mother who, they had a machine on her. and was able to actually see the oxygen content change while I worked on her. So, you know, I've been able to see people who've had machines on there and watch the numbers change with the BioTouch. So BioTouch is a great technique that actually, since you've never been here before.
I've taken the training.
Huh?
I've taken the training.
Oh, you did?
Yeah.
Oh.
Years ago.
Years ago? Well, there you go. So you're not new.
In the other building. It wasn't here.
Down on, when we were at,
I don't know. It wasn't here.
yeah. Wow, that's a long time ago. So.
That's why I
Welcome
can
back.
reset and say I've never been here.
Yeah, okay. So anyhow, for those who have been here a long time ago, it's basically taking the 2 fingers of each hand and lightly touching on the body. So just reach over and do that to somebody so you get a sense of, Heidi, why don't you come sit up here? Or okay, you got somebody there. So, you know, the big part of BioTouch that people always want to know is, where did it come from? And we don't give a lot in these. This is just a 2-hour workshop. If you're interested in the whole spiel and all the research, you can take our 8 to 10 hour training. We have one coming up in the next 2 Thursday evenings. We have them on weekends. But basically, it came from a mining engineer in Colorado. And I'm the one who met Norman, and I was the stooge that made BioTouch public. And that's the short of the story. If you want the long story, it's in that little book over there, BioTouch, Healing with Power in Her Fingertips by Deborah Schillhouse. It's a fun little read that talks about my hippie days and bathing with the beavers and, you know, no running water, no electricity. But I got involved with BioTouch because I was in this town, 900 people in a very conservative community, and everybody was going to Norman and Carol for healing work. And in the 80s, that was unheard of. Like, who the hell did healing work? But they were all going to him, and one old-timer said to me, Norman and Carol brought love to the Mancos Valley. And I just want to give a pitch that one of our recipients just wrote a book, Paula Taylor, and she acknowledged BioTouch in her book. And it's about doing healing work and self-healing work and energy work, and we don't necessarily consider ourselves energy, but she talks all through this book. She gives you all her whole journey, gives you all kinds of things to do, but then she acknowledges BioTouch at the end. And I was like really honored to be part of her book. And the reason I was honored, because when she went through this whole book, she basically said, you know, it's just about letting yourself be loved. That healing was about letting yourself be loved. And I was like, that's our whole premise here. You know, that we go into that room and people remove their shirt or their blouse and we touch them skin to skin, one person to another. It's just about love. We're not projecting anything. There's no level of healers. You can take anybody on the streets out here, teach them to do a couple of sets of points, and they're going to be as effective as anybody who's been doing it like myself for 30 some odd years. And that's powerful. That's a powerful healing technique. So you'll never learn here about diagnosing. We send them to the doctors. We let the doctors give the medications. And we say, just add BioTouch. Just take it home with you and add it to your healthcare program. The big buzzword now, of course, is integrative medicine. So we're part of the integrative medicine approach. Also a new buzzword is functional medicine. That's the new one, which I found out functional medicine is actually a part of integrative medicine. And functional medicine is actually trademarked. So there's this whole, you know, it gets so complicated out there. Along with all the energy techniques, Joe Ray, Reiki, healing touch, therapeutic touch. I mean, there's dozens and dozens of techniques. Once somebody learns a technique, they combine it with another, and we have hundreds of new techniques in the energy work, the healing work. What we're trying to do is teach a technique and keep it simple. So the points that you have up on that chart are all in this manual, and it will take care of anything that the body can hold. It doesn't matter whether it's a pain or a symptom of disease, or, which we're really trying to get to, a good preventative care. So you take the vitamin C during the flu season. Well, if you did BioTouch 2 or 3 times a week during the flu season. I think you could probably divert, or maybe you might still get sick, but you go through it in 2 to 3 days instead of 2 to 3 weeks. We've seen that children who've had this done on a consistent basis in school, they'll still get the flu or the cold, but they don't last as long. They're not hacking for weeks and weeks and weeks. It goes through the system. It's sort of like the old guy said in the 1890s. Just, if you play it out, it'll go away. I don't like playing it out. When I get sick, I get very cranky and very scared, and and it's like, oh my God, and you turn on the TV and there's all that fear. So, if nothing else, these points you're going to learn today are going to be great during this time of a great amount of fear. Even if we do these points that we're going to share, even just the one point of the infection and the greeting, to help as a preventative care. And will we know if it works? No. Does it matter if we know? No. So, that's the technique. So what we've done is we've taken two or three sets of points on these Thursday classes, and we've given you a little workbook. And in this, we're going to just share with you the few sets of points for a particular condition. And if you go to the first couple of pages, it says, what is BioTouch? Oh, here. What is BioTouch? And we sort of went over that. It's a light touch healing technique. Who can do it? Anybody can do it. I mean, that's what's nice about it, too. You can teach 6-year-olds how to do it, 96-year-olds how to do it. It can be done in the hospital. It can be done at home. It can be done in front of the TV. It can be done in a bar. We have a woman who does it in Chicago in a bar. That's what she does for her tips instead of dancing, Yeah, and she loves it. And then she works on all the other women who dance there, and she's like the mama of the bar and stuff. And it works. You don't need a place that's all, like I always joke when I met Norman and Carol, there was nothing but smoke and coffee and sweets. There was no tingling cymbals. There was no incense. There was no whale music, blaring over a speaker. It was just down home, Southwest Colorado. And that's what excites me about doing BioTouch is you don't have to give up a part of yourself. There's a lot of techniques where we're told we need to center ourselves and be an all-kind, loving person. Have you ever met one? I don't know if I could look him in the face. So we all have stuff. We all get angry, we get greedy, we get fearful, and we're loving, and we're kind, and we're compassionate. We're all those things. And so here's a healing technique that you don't have to get rid of any part. You just go into the work doing the points that we're going to give you, doing the greeting, and letting the story unfold. We don't recommend here. We don't make any diagnosing. We don't tell you what you should do or shouldn't do, even drink water. If you want to drink water, we have water. We have tea. We also have beer in the fridge, so take your pick. And we've already said, too, that it's also a complement to anything else that you're doing. It's easy to add this to what, like we're getting ready to go in for a knee operation on Wednesday. So we're doing a lot of pre-work, along with all the paperwork you have to fill out. My God, it's crazy. But we're going to do a lot of pre-work, and then we're going to go right in after the operation. We're going to start working on it right then and do all the physical therapy with it. Will we know if BioTouch helped or not? No. But we're going to do it, because I just have to believe it's going to help in the healing process. So pre and post-op, BioTouch is great. Pre and post pneumonia, just if you get the vaccine, get BioTouch too. If we made this part of our elder programs, I mean, how great could that be? If we made it part of our birthing program, how great would that be? So and so we've talked about all those things of what it is. The terms used in the manual there, we're not going to really go over those. They're not that important, but they are the language that we use in teaching BioTouch. Any questions about BioTouch as a technique or comments? People have used it in their life or not used it in their life? Sally, have you used it in your life?
The healing power of touch.
Yeah.
I've been with biotouch. I tried to figure out when I started. I don't know. It's been at least 12 years. And I started with a foot joint that wouldn't heal. I replaced the joint in my foot. It just wouldn't heal. And that started it. And then we worked on foot flesh, where I had constant pain. And then, I've had 4 other joint replacements. And, biotouch through all of those. It's an amazing technique, and it's simple. It's not rocket science. It is not involved. It's great.
In fact, when Sally used to work back in the old days, she taught nurses. Over at Pima, and she'd bring us in every semester to expose all the nurses to biotouch. And a few of them actually took her up on it and applied it to their nursing program. So it's really good to get it into the system, like you just said. Just bringing touch back into the system. And we actually almost worked over here. It was for lung and I can't remember what it was. It was on Wilmot there, but they were actually going to allow the technicians and the nurses to not have to wear gloves when they did biotouch. Kinder care, yeah. And they worked a lot with pneumonia and bronchitis over there. And
I had a coworker who became one of my students who had migraines, and immediately after doing the headset, they were gone. Right. And then, of course, she got to where she didn't have them anymore.
So we're going to focus on pneumonia and bronchitis, which is all that stuff that happens in the lungs. Any other questions about biotouch before we teach the points? No? No?
We know it all.
We know it all. We do. So here's what we're going to do. We're going to teach some points, and then we're going to break up and practice those points. And so we're going to bring our little mannequin up here. Okay, Sherilyn.
All right. So before you do any biotouch at all, you always do the greeting. And this is only set where you only use one hand, and you always use your dominant hand. So point 1 of the greeting, you're going to use your dominant hand, these 2 fingers, and the soft fleshy area just below the breastbone. And you're going to hold for 6 to 8 seconds. Point 2, you're going to go 1 to 1.5 inches to the left of the big bone. So you find the big bone, wherever it is, right there. 1 to 1.5 inches to the left. And hold for 6 to 8 seconds, again with your dominant hand. This, what do we call it? We call it like the key that opens up and reminds the body of its ability to heal itself. So no matter what biotouch you're going to do, how little or how much, always do the greeting. And like I said, it's the only set where you only use one hand. You go into infection.
Infection
And allergy? Okay. So infection and allergy, your hold is going to be in, same as greeting point 1, in the flesh area just below the breastbone. And then you're going to, for infection, you're going to go on that large muscle on the right side of the body, the bottom of that large muscle. And it's, well, never mind, the metabolism. So this is infection. This is infection. Getting instructions. All right, so any allergy that a body can hold, infection rather, You can use this set of points to address any infection anywhere in the body, whether it's from lung infection, colds, flu, tooth infection, a cut in the body. So you're going to hold there for 6 to 8 seconds at the bottom, at the base of the large muscle on the right side of the neck. Then lift and repeat. 6 to 8 seconds. Then allergy is going to be at the top of that large muscle. And again, any allergy that you may have to whether it's food, chemicals, pollen, animal hair, cosmetics, food, whatever. So you're going to hold for 6 to 8 seconds, lift, and repeat. And you can do it as many times as you feel is necessary. And you do the allergy separate from the infection. They're separate points. Okay, any questions? All right, thank you.
So again, if that's all, and those are easy to do without even having to take off a top, because you can just go under a shirt, go through a buttonhole there, the break in the button, and so it's easy to do those 2 points. And then it's easy to get that finger back in there and do these. So those can be done anywhere at any time. So the minute if you've been even exposed to a virus or a bacterial infection or somebody coughs and you start freaking out, you could just do that. I mean, I've actually, worked with people in emergencies just on the allergy point with people who've eaten like shellfish or something. And so it's highly effective. And the reason we're doing the allergy point too is, sometimes those lung problems could be allergy triggered. And then the allergy turns into your immune system breaks down, and then, so it's a cycle that goes on and on. So we just wanted you to know that can also be done, but at least for sure that infection point. Okay. So now, once it gets into the lungs, let's work on that lung set. So on the next page there, we have the lung set. Now, of course, this one you need to, now we do touch on the skin, okay, because that's how BioTouch is done. And so having the skin exposed and the lungs is really important. And this can be done sitting up or laying down, whatever you can get to. What you do is you have a hold point. Most of these points, these sets, like Sherilyn just did, have an X. And that X usually means that finger, those 2 fingers stay stationary while the other hand does a series of points. Okay? So point 1 on this set is at the rib cage, because the lungs sit behind the rib, so not quite the bottom rib, just before it turns to the side. And again, this is not an exact science like acupuncture. You got this much room to play with. It's not like you have to be needle point exact. So you're not quite the bottom rib, just before it turns to the side. And then point 2, and it might be the side. No, I'm okay. Point 2 is just under the breast, just before it turns to the side. And if you can't get under it, you can come to the side too. You just want 1 point somewhere in the middle of getting to the 3rd point, which is 2 to 3 inches in from the top of the armpit. So now you're working in those bronchial areas. And then you do those same points on the other side for just before it turns to the side there, 5 and 6, 2 to 3 inches in from the top of the armpit. And all the points again, 6 to 8 seconds. Now, BioTouch is done with points on the body, but this is one of the times where we actually put our whole hand there. And you can see on right by his head there's a picture of sort of the butterfly hands. And what we're going to do is we're going to encase those points that we just did. Somehow it just seems to really help break down fluid in there.
The
Okay.
matching fire first?
No. No.
Matching fire with the.
No, we're on step 2.
Yeah.
So step 2, now we're taking our open palm and we're sort of encasing the ribs. I'm going to sort of try and get in here. So we're covering 1 and 4, 2 and 5, and then under the armpits 3 and 6. Now some people feel like that's an uncomfortable set of points to do, but you know, if somebody has pneumonia, bronchitis, COPD, they don't really care, you know. And then you do the matching fire. So there's not a lot of points, you just do them in different ways. Matching fire means you do the same point on either side of the body. So 1 and 4, 2 and 5, and 3 and 6. Now, one of the things we do a lot in BioTouch is what we call enhancements in local work, which means you work an area that's in distress. And so if somebody's really hacking from up in here, you can just do some sweeps. Sweep is where you slowly and deliberately move your finger across an affected area. Or you can do extra points. You might want to do front and back. The key to understand is you can't hurt anybody. So you could do a bunch of extra points that come to you to do. I might hold in the back and sweep along the front. Because you also want to know that the nerves that come off of this area of the back affect the lungs. Chiropractors work a lot that way. Every nerve has a very specific vertebrae that deals with and comes around and communicates to the lungs. So we work a lot that way too. Worked with a woman who had COPD, a lot of lung issues. You know, always was getting sick every year or two. And we worked on her a lot, and she ended up in the hospital. She couldn't get that fluid out, and they had to syringe it out, which is why we always remind people, work with your medical professionals. And she couldn't wait to come back. She said, oh, BioTouch, it just stirred up the pot and I couldn't get it all out and I can't wait to get back and get worked on it. She started breathing better. All that fluid was able to get out of her, but she didn't have the strength to spit it up on her own. So that's why, you know, BioTouch is real important. Whether you're taking an antibiotic or, you could actually on that infection point, if you're doing an antibiotic and you're worried about the side effects of it, you could add the poison set, which will help the body get rid of, if it's a poison to the body, while allowing the antibiotic to do what it needs to do. It doesn't negate what the drug is supposed to do. It just can help with the side effect part of it. And this is all speculation. I can't prove any of this to you, except the research that we had. Any questions about the lungs? So that's getting real specific, especially in an emergency situation if you're on the way and you can't get into ICU because it's a 6-hour wait and they're really in pain or hacking. You know, it's real important to do that. The third set of points that we'll do here, which reminded me when Sandra talked about the whole throat, you know, and getting that to really work, is a metabolism set, which helps the body get rid of what it doesn't need and assimilate what it needs. And that first step is right on that throat area. And it's a matching fire, and we're staying on front of these large muscles here. And so we're just above the collarbone in front of that large muscle, which is 1 and 1. And then halfway up that muscle, that's 2 and 2. And at the top of that large muscle in front of it is 3 and 3. And then even what Sandra did with her fingers, and she went like that. Well, you could do that too. You could just do extra work and sweeps right down that throat area. now that we know that that's an important thing of the throat. Then we have step 2. And basically your hold point is that X that's on the left breast. And the way you find that is from that greeting point 1, you basically come up about 1/3 of the way up the breastbone and over an inch to 1.5 inches. And you're going to hold that. That's your X. Now you don't have to remember these things because it's all verbally exactly the way that we're describing it. And then you'll be able to download the PDF version of that, and it'll have links to the video. So it's easy to play the video and see somebody doing it while they tell you where the points are too. Plus, this video will be on Facebook and our website. Plus, if you have any problems, you come in here and we'll walk you through it again. There is no reason you can't learn BioTouch. So that's your whole point. You're going to work those 4 points on the back of the body. Point 1 is on your left spine muscle. And we would talk about the breakover, but that's too hard to do. You just stay below the shoulder blades on the left spine muscle while you're holding that front. And point 2 is on the right spine muscle below the shoulder blade. Point 3 is above the hips on the right spine muscle. And point 4 is on the left spine muscle. And when Sandra talked about diabetics and their problem with pneumonia, then this is specifically designed to help with blood sugar problems. So you could repeatedly do point 4. Any questions with those? It's actually quite easy. Now, we sort of gave them to you in the order that you could do them, too. So, you know, if all you could do was the greeting, that's starting a healing process. If all you could do is the infection, then if you can get to the lungs, great. And then metabolism is really to help that body, you know, start healing itself. So, what we'd like to do then is practice these points. So, we have 3 practitioners, and we have 2, 4, 6. Okay. Are you going to stick around and practice, or? Okay. So why don't the 2 of you go together, and Deborah, you check them out. Yeah. And then why don't Heidi and Terry, is that it?
Yes.
Why don't you go with what's her name? Sherilyn. And then the 3 of you go in the first room, and I'll work with you. And bye, everybody.